Hello guys, my name is Scott Wall. I'm doing my project this week on Roy's adaptation model on elderly adults and their pain. I have my girlfriend here as my assistant, so say hello.
Hi everybody.
So basically we're gonna get started. So we're gonna begin now. Hello Ms. Lopez, how are you doing since your last appointment?
I've been having a lot of pain for the last 3 months and it's very uncomfortable. I cannot cook, I cannot sleep, and I need my son to do everything for me.
I am sorry to hear that. Let us see if we can do something about that. I would like to describe a method in which has been used to treat chronic pain for a long time in elderly adults. It is the Roy adaptation model. This is a model that uses holistic approaches that look at stressors and how people respond. Not only does it treat the patient themselves, but it also treats their family as well. It offers a systematic way of evaluating pain in adults. Studies have shown that 60 to 75% of older adults report pain. Pain oftentimes gets underdiagnosed and undertreated. This can lead to depression, disability, and suicide. Does that sound like a approach that you would like to try?
It actually does. I would like to try it.
All right. First off, can you tell me a little bit about yourself?
Well, I am a 7-year-old woman that is very uncomfortable, have a lot of pain, and I have to have a lot of help, which my son has to help me for everything, and it's pretty uncomfortable, and I don't like to tell him.
All right. And what are you taking for pain right now?
I'm taking Tylenol, but it's not working.
Not working? Okay. How is your relationship with your son?
It is a great relationship. He helps me on everything, but I don't like to tell him how uncomfortable I am when I need help from him for every single thing.
All right. So based on all, what we're going to do is use the Roy 4 adaptation model, and basically what we're going to do is go through these little the physiological mode, the self-concept mode, the role functioning mode, and the interdiscipline mode. Basically what we're going to do now is it's basically observation and assessment questions. I'm going to observe and discuss questions that she has, and then I'm going to give her questions to try and kind of go about assessing her in more detail. So we're going to do that right now. Just read these. Okay, for the physiological mode.
Pain for the worsened in the last 3 months.
All right, and some of the assessment questions we'd like to ask are, where's your level of pain? Just make up a number.
10.
10, all right. Where is the pain?
My back.
All right, is it constant or does it come and go?
Constant.
All right. What makes the pain feel better or worse? Is anything?
Sometimes medication helps.
All right. Can you tell me your activity level over the last few months? Have you been able to?
Very low.
Very low. Okay. Have you been able to do wash clothes or do anything yourself?
No heavy or repetitive movement.
All right. And next, we're going to move on to the self-concept mode. And you want to read those?
I have lived a life with this. I am slowing down and frustrated.
So, and then from here, we would like to discuss questions like, describe your feelings about getting older.
It's hard.
Right. And then tell me about your frustrations. What makes you frustrated?
Unable to do things for myself.
All right. And what are your hopes for feeling better?
I am hopeful that this treatment will help me.
All right. And then the next step, we're going to go to the role function mode. And then you're going to go, and this one is kind of for her son, and it discusses how he feels about his mother.
This is not my mom. He is not used to seeing me like this.
All right. So what we want to do here is we want to discuss how their interaction, the patient's interaction with their family. And from here, we're going to go, how is he used to seeing you?
Mobile, active, doing things for myself, or him, and then him for me.
And how do you feel about your current physical health? Do you feel depressed? Do you feel angry?
It does get me depressed and angry,
all right,
which leads to my frustration.
All right, and then the next one is the interdependence mode, which is the last one.
I cannot tell him how uncomfortable I am.
And some of the questions we're going to ask this is, what is stopping you from telling me this?
because he cannot help me with my pain. He can only help me as much as trying to get me comfortable.
Gotcha. All right, so those are the four Roy's four adaptive modes, and then from there we would have six nursing process interventions, 6 steps that we can discuss. Basically, the first one is the assessment of behavior and assessment of stimuli. And what we want to do here is we'll look at kind of like how the patient's physical pain, where their pain is located, how they're describing the pain, and because in this particular case study, it was a 70-year-old female with back pain due to kind of spinal stenosis, osteoporosis. She's basically been not able to do her ADLs, not able to really do much of nothing, relying on her son. So it's created a lot of depression, frustrations for her and her son. So the nursing diagnosis would be, let's see here. I know I have that around here somewhere. The nursing diagnosis would be chronic pain related to inflammation of the spine as evident by patient reporting lower back pain, disruption of social and family relations, and depression. After your nursing diagnosis, you go on to setting goals. Goal settings. Some of the goal settings may be patient will report improvements of back pain, increased ADLs, and also listing of 5 non-invasive pain relief, and see if we can get these goals to set. And what you want to do is try and create goals that are attainable, not something that's totally, she may never go back to being 100%, being able to run, be able to do all that, but just getting some mobility and being able to do the basic functions of her life is very important. And the next step would be interventions. And the way we would intervene as nurses and providers, we'd assess the patient's report of improvement at each visit, assess patient's expectation, because that's very important, because sometimes patients feel like they again goes back to where they feel like they're 20 years old again. They can do the same things they did when they're younger, and sometimes that's not possible. You also want to check on the patient compliance and make sure they're complying with everything. And they're giving it their best effort. And you also want to educate them on their medications and pain relief measures. And then the final is evaluation to see how these methods are working. And if these interventions are not working, then we have to go back kind of to the drawing board and try again. But Roy's adaptation, I've read a lot of articles in the past that have shown really good improvements. One particular one was on chronic pain and arthritis with depression as a major outcome. One of the studies showed that 71 older adults with arthritis had a large amount of depression, and due to their inability and their reliance on other people. And they concluded that this study, along with some other middle range theory studies, were effective in being able to assess these patients and help these patients with their chronic pain. Thank you, and I'd like to thank my lovely girlfriend for helping me out. Later.